I'm Dr. Joe Nyamtu, live at the 2018 Aesthetic Show in Las Vegas, Nevada. It's about 105 degrees outside, and it's hot in here because of topics and knowledge and everything that is going on. I'm very happy to be live with a very famous person here, okay? Dr. Jennifer Walden, who is a plastic surgeon, and you've been at this meeting a lot, I think. And you know, Jennifer, if you are involved with cosmetic surgery, it's pretty hard to pick up a magazine or look at a TV show or a journal article or a textbook and not see something about Dr. Walden. So welcome
Thank
today.
you. Wow,
and you've been here before, yeah?
Well, this is actually my first aesthetic show meeting. Yeah.
I thought you'd been here.
Yeah,
See, you know
no.
why? Because you're omnipotent. You're everywhere.
Yeah.
So
You'd figured I had, but
Yeah.
no, this is my first one, and I'm so impressed. It's just amazing. It's a great place and space, and I like the congeniality, the multiple specialties. We learn so much very quickly picking up from other specialties, whether it's or a maxillofacial or facial plastic surgery, or even the estheticians, the wellness, and OB-GYNs, urogynecologists. I've learned so much just today.
Yeah, it is a great meeting. Now, you are a board-certified plastic surgeon.
Correct.
And you trained at one of the meccas at Manhattan
Right,
Pioneer.
that's
so
right.
you do things from head to toe.
Right.
Now you have one of the publishers of the White textbook.
Yeah,
right,
And exactly.
So my second edition just came out, so I know how hard it is
Yeah.
to write a textbook. And,
Yeah, a lot of work.
So it's great. Now, we're talking about feminine rejuvenation, Jennifer. And if you went to meetings even a decade ago, first of all, there wasn't much about it, and it was almost taboo. So talk to us a little bit about how this has gotten to front and center. You know, when I walk down this hall and look at all these posters, so
Right.
many of them are about feminine
Every other
rejuvenation.
one, yeah. I
So-
mean, and I did train at Manhattan Pioneer in New York in 2003 to 2004, and I maybe did one or two surgical labiaplasties in my fellowship, and I did some during my practice, but within the last 5 years, there's been a tremendous boom in surgical labiaplasty and vaginal rejuvenation. I think a 217% increase in the last several years. But also in the non-invasive vaginal rejuvenation, there has been an explosive growth, and is expected to double and triple in the growth of the aesthetic industry. And so I never would have thought that's where I would be, but I have a huge vaginal rejuvenation center, and we have most of the device technology, whether it's laser or radiofrequency, and I have a clinical researcher on staff, and we do IRB-approved trials, kind of trying to separate through some of the myths about these devices. And what we find are that they are safe and efficacious, and most of them work very well. And so it's a great safe place to be in for a plastic surgeon. My estheticians are able to perform those treatments, so I delegate them in the state of Texas. And I really like helping people, and that's something in aesthetic surgery, not every day, you know, we have a very demanding patient population, as I'm sure you're familiar with. These people are very thankful and very appreciative just to help them with stress urinary incontinence or the ability to achieve an orgasm again, something as basic as that.
And you know, one of the things, and of course, I always associate your name with academics as well. And what you said, I think, is really important, is trying to separate really the magic from the science. So a couple things that are interest to me. What percentage of your practice is female?
So right now, my practice is about 97% female, 3% male.
Okay.
But we are rolling out more male services, and so it's interesting you say that. We've recently rolled out our Biomedical hormone wellness therapy, and I have a nurse practitioner who actually used to work for a urology group, and that's her thing. She feels very comfortable with the P-shot and that sort of thing. So we're offering male services in the big D wave as well. We're starting to roll out. So I think that number should really vastly increase over the next year, so I'll be interested in seeing. But it is vastly female right now.
I think it's really interesting when you talk to so many experts. How long have you been out of training?
Since 2004, so
Okay,
about
so
14 years.
You didn't see yourself being such an expert in this field.
Not at all.
Now, when you, how do you market this population? Because it is a little bit discreet, and I've seen some really cool ads that address it in different ways, kind of similar to the Viagra commercials that you used to see.
Yeah.
But how do you market this personally?
One of the good things about this time-wise was that I had a full cosmetic surgery practice before these non-invasive vaginal rejuvenation and male treatments evolved. And so internal marketing was the key to the start of all of this med spa and vaginal rejuvenation part of my practice. We were able to send constant contacts, brochures, posters, and that's really a great way for these sensitive topics, is to address, you know, they know you already, you've bonded with them over some other type of procedure, whether it was Botox or I did their tummy tuck or whatever, or their mommy makeover. They now are able to say, you know, I do have urinary incontinence when I jump or laugh or that sort of thing. So that, number one, but then it easily kind of can parlay into some of the more subtle advertising we see with ED. Facebook, well, they'll turn down ads if you mention the word sex, vagina, penis. So you have to be real crafty and about the way you do it, and it might just be a couple kissing and saying, we can make your life better, or get ready to feel young again.
Sure.
But people will click on that, and then they'll go to whatever page on the website or about our practice. So we can be kind of crafty in those ways, and maybe a little bit more forward on Instagram, other forms of social media than Facebook. But yeah, I found it's gone pretty well though. It picks up steam pretty quickly, I think, once the word of mouth gets going.
Well, but you're pretty special in this field. And one of the things you mentioned, you know, your practice is totally cosmetic surgery, as is mine, except I only go from here to here. So you cover a lot more area. When people come in, what are the most common female complaints related to your work?
So from a surgery standpoint, my most frequently sought after procedures are breast augmentation, which you would expect in Texas, labiaplasty, so genital rejuvenation is very big, and also in an older female population, facial plastic surgery like facelifting. In the med spa, I mean, we do a lot of injectables. I have a great provider who has a huge following in Austin, so Botox filler, of course. And then as far as the other med spa procedures, the CO2 laser, resurfacing, that sort of thing, those are very popular and sought after. But vaginal rejuvenation is often, I'll look at my schedule every day for the estheticians, and I'll see several vaginal rejuvenation consults and treatments on there almost every day. So that's a big one too. And
so you have your aesthetic feminine procedures like labiaplasty, and then you have your more sexual oriented. And then what about functional, like urinary incontinence and things like that? Yeah,
so for urinary incontinence, generally we're going to treat that non-invasively. If there was something so complex it needed surgical treatment, I would refer it to a urogynecologist. But, just Vivive has a great SUI or stress urinary incontinence protocol. Diva works nicely, Cyton Diva works nicely on stress urinary incontinence. FemTouch. So the energy-based modalities are great if you follow the timeline, and get the serial treatments that you need to treat urinary incontinence over time, as it tightens those muscles and helps provide pelvic muscle support.
Now, training in New York City, again, Manhattan, I mean, that's the big place. And the mores and the values and the aesthetic eye and everything. What was that like going to Austin, Texas, darling?
Well, so I was born and raised in Austin, but but I hadn't been back, since before residency. So it had completely grown and changed. It took about a year to decompress from the hustle and the bustle and the pressure of New York life. Everyone in New York kind of wants it done and wants it done now, and that's fine because that matches my personality. So I actually had to try to relax, and things just didn't, patients are at a slower pace. They might have been at a slower pace to sign up or to do certain treatments than in Manhattan. More people in Texas, you can imagine, seek kind of the body contouring and breast procedures. So I do a lot of those there. More tummy tucks, way more tummy tucks in Texas than I did in Manhattan. Okay. So there's different geographic preferences. Awesome. The implants are a little bit on average larger in Texas than they were in Manhattan. The cheerleaders, they're probably your patients. Well, look, we have to wrap it up. I have one more question. Tell us, question number one, I have two more questions. Yes. Tell us something nobody knows about Jennifer Walden. Let's see, nobody knows about me. I guess, well, gosh.
It doesn't have to be illegal, but just something that they wouldn't expect.
Hard. Yeah, it's because it might be written about. I'm a single mother by choice. I did IVF back when I was in New York because I wanted to have children, and I just hadn't met the right guy. So I have two of the right guys. I have two twin 7-year-old boys.
Oh, that's awesome. Last question. When you get home from work, kick off those doctor shoes. What's your passion?
What's my passion? I like to get in the pool, swim around with my little ones, and I like to watch Netflix. My passion, like Amazon Video, Netflix.
What's your favorite series on Netflix?
Scandal. I like Scandal.
Oh, okay.
Yeah.
Did you watch Shameless yet?
What?
Shameless?
I haven't, but I'm going to. I want to. I'm
Hey,
just catching up.
Listen, Jennifer Walden, Austin, Texas, plastic surgeon, expert in feminine rejuvenation, live at the Aesthetic Show. I'm Dr. Joe Nyamtu. Thanks so much,
Thank you
Jen.
so much.
All right, great.